But before we get to that, can you just give us a brief history of the HMO industry from the 1970s up to the present?
Sure, and let me try to give you the Reader's Digest version, because I actually came into this business, as you mentioned, out in Minneapolis, working for a small health policy research firm called Interstudy that was actually very influential in convincing the Republican administration, the Nixon administration in the early 1970s, to make health maintenance organizations part of national health policy for the first time. And Nixon's vision was, by introducing competition into health care and starting up some 2,000 new health plans in America, and using a sort of a marketplace model, we would drive down healthcare costs. At the same time, we'd provide more comprehensive coverage than ever before. The whole notion resulted in a legislation in 1973, the Federal HMO Act, that actually provided seed money to start new health plans all over America. I ended up coming to Bridgeport, Connecticut, in part, as did many of my peers who left Interstudy to go start health plans based on the awarding of grants and loans to start these new health plans. And the concept was a very good one, although health plans struggled quite a bit to really get a firm foothold in our economy and compete effectively with major insurance carriers and Blue Cross and Blue Shield, which had been established for a long time in our country. But what happened in the 1980s, Ronald Reagan came into office and basically said, we're not going to provide any more federal grants and loans to health plans, but if health plans want to really grow and become a major part of healthcare reform in America, they should go get their capital from Wall Street the way the rest of American industry does. And that led to a wholesale change of the health plan industry, and most health plans ended up converting from nonprofit to for-profit status. And there was a huge infusion of new capital into these health plans through the equity markets, through Wall Street. Some in the early 90s, $4.5 billion a year was coming into these health plans. And what was happening is, frankly, it was working. The health plans were innovating. They were doing things that hadn't been done in traditional health insurance before, with emphasis on things like utilization review. We put nurses into the hospital for the first time to monitor length of stay, and we did concurrent review to question whether a patient needed to be treated. We did prospective review where we looked at whether a patient even needed to go into the hospital. And we just did some really innovative and creative things that were effective in driving down healthcare costs, all the while providing our members, consumers, the American public, with broader healthcare coverage than ever before. And that we were covering things like physical exams and well baby care that heretofore had not been covered by insurers except after maybe an expensive copayment or deductible. And if you look at what happened with healthcare costs by the mid-90s, it's hard to believe today, but healthcare costs driven by health plans growing and expanding and being very effective in America, healthcare costs in 1995 went up about 1%. But then you look at what happened after that is, as health plans continued to grow and thrive, they, frankly, we kind of plucked all the low-hanging fruit in healthcare and reducing healthcare costs, and we began running into some of the major societal problems that vex us to this day: an aging population, exploding new medical technology, the new and intractable diseases like AIDS we had to deal with, and frankly, and kind of an insatiable demand by the American public for more and better health care. And we also began to get some pushback from the provider community, doctors and hospitals, who kind of resented the way we were managing care in terms of looking very carefully and with great scrutiny at the way doctors and hospitals practice care. So as a result of that, health plans, frankly, stopped pushing so hard on controlling healthcare costs, and that was the kind of patient protection era that we went through in healthcare in the history of healthcare in America. And healthcare costs started going back up again by double-digit amounts for several years.
So you would say pretty much from the 70s up to around the mid-90s, around 95, that the HMOs were doing a very good job of controlling healthcare costs, and really because of, both outward pressures and issues in the market, difficult diseases to treat, the other reasons you gave, where it really started to spiral, where you started seeing these increases in costs from year to year.
Right, and so I would give HMOs a very good marks through, as you say, a good 25-year period there in managing care in a more effective way than had been managed in America prior to that. We were actually converting kind of a cottage industry, bringing it into the Industrial Revolution, and managing it better than it had ever been managed before.
Well, the next question I was going to get to, and we're going to stop for a minute, Mickey, because I wanted to go to a commercial break from our friends at MediStar. But the next question, and I think it's an interesting one, because this is really goes right down to where you have argued before Congress and many other boards about how the free market, in your belief, can do a better job than a single-payer system in controlling costs. And we're going to get right to that question when we get back to the Healthcare Business Network, right after this commercial from our friends at MediStar.
Are you looking for a billing company that can increase your revenue, effectively manage your credentialing, deliver the right software, and provide guidance in navigating the minefield of compliance? MediStar has been providing the right answers for hospitals and physicians for over 13 years. We go the extra mile by paying attention to the details and focusing on aggressive follow-up. Recognized for 4 straight years by Inc. magazine, our professionals can help you attain your revenue cycle goals while helping to ensure that your work is done in a compliant manner. Call one of our experts toll-free at 888-423-8080. That's 888-423-8080. Or visit us at www.medistarbilling.com.